We are talking all about the thyroid today with Dr. Eric Osansky. We're going to talk about hyperthyroidisms, so hyperactive thyroid and Graves disease. And we're also going to talk about hypothyroidism and Hashimoto's. He's a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has been helping people with thyroid and autoimmune thyroid conditions since 2009. He's the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves Disease, the Hyperthyroid Healing Diet, and Hashimoto's Triggers. He's the host of the Save My Thyroid podcast and the creator of the Gut Healthy Thyroid newsletter. So if you want to get that newsletter, he says it sounds like it's like kind of his big thing is very informative. Go to savemythyroid.com/newsletter and you can start getting all sorts of information from him there. And yeah, Dr. Osansky himself was personally diagnosed with Graves' disease. And after seeing how well a natural treatment approach helped with his condition, he began helping others with thyroid and autoimmune thyroid conditions. So he's lived through this stuff himself. He's been doing it since 2009. And this whole episode is just so informative. So I tried my best to like represent anybody who might have either of like both the autoimmune, Graves or Hashimoto's or just hyperthyroid or just hypo, So I tried to rep you guys well. So hopefully there is answers. Hopefully there are answers. And there's also just a lot of wisdom in this. So I hope you guys enjoy that. And before we get into the episode, I want to thank Paluva for sponsoring this episode. So Paluva is Mark Sisson's shoe that has the 5-toe articulation. It helps you have better biomechanics, walk how your feet were meant to be walking on the ground, which is going to affect your movement patterns all the way up. So try them out. Try getting your toes unsquished and your walking pattern normalized and your feet strengthened. And you can get 15% off if you use code Coach Tara. And you can do that really simply by just going to Peluva, PELUVA.com/Coach Tara. Okay, let's go ahead and get into the show with Dr. Eric. All right. So, Dr. Eric, we were talking before the show, and I was like, I don't have a resource for people on this podcast about hyperthyroidism, which we'll say you had just to be like that. I've heard you talk about how, permanent remission. But anyway, that's something you've dealt with in your life. And I would like to talk about that. And I would definitely also like to talk about hypothyroidism and Hashimoto's and all of it. But real quickly, just to kind of set the stage, can you describe for the difference for anyone who might not know the difference between hyperthyroidism and hypothyroidism?
Sure. So with hyperthyroidism, you have elevated thyroid hormones. So the main thyroid hormones are T4 and T3. And then I'm sure other guests on your show have talked about TSH, which is thyroid stimulating hormone. And so it's actually a pituitary hormone that communicates with the thyroid gland. So because you have too much thyroid hormone, typically you'll have very low, if not undetectable TSH levels because the pituitary doesn't want the thyroid gland to make more thyroid hormone. So you have elevated thyroid hormones, low TSH. Symptom wise, that can present with, and like in me, when I dealt with hyperthyroidism and Graves, I had elevated resting heart rate, I had heart palpitations. Not everybody experiences weight loss, but I lost a lot of weight. I lost 42 pounds, which I wasn't trying to lose that much weight. And anxiety is common, hair loss is common, speeds everything up. So besides the weight loss, increased bowel movements are pretty common as well. A lot of people with Graves specifically have also what's called thyroid eye disease, where the immune system attacks the tissues of the eyes. And so you might get bulging, swelling, pain, double vision. And then with hypothyroidism, you have lower thyroid hormone levels. Sometimes they're subclinically low, where they're within the lab range, but not within the optimal range. But so they're either on the lower side or, again, below the reference range in some cases. And then because they're low, the pituitary gland communicates to the thyroid gland, hey, we need to make more thyroid hormone. So it spits out more of that TSH. So you usually will see higher levels of TSH. Again, sometimes they'll be clearly elevated. Sometimes they'll be on the higher side, like not within the optimal range, but within the lab range. And then symptom wise, fatigue is common, weight gain is common, brain fog is common, brittle hair is common. I mentioned like loose stools with hyperthyroidism. So with hypothyroidism, a lot of times you'll get constipation, coldness. So like with hyperthyroidism, a lot of times you'll get like heat intolerance. So, but with hypothyroidism, coldness and thinning of the eyebrows is like the outer third of the eyebrow is pretty common. And yeah, and that those are really the main differences when looking at just the thyroid panel and the symptoms. And then of course there's Graves versus Hashimoto's, which are both autoimmune conditions, and those involve different thyroid antibodies. So I don't know if you want me to
Yeah,
cover
please.
the
Yeah,
anti. Yeah.
let's that for sure.
Sure. So with Graves' disease, you have what's called thyroid stimulating immunoglobulins, which is a type of TSH receptor antibody, and they attack the TSH receptors of the thyroid, and that's what causes the increase in thyroid hormone. And sometimes those same TSI, thyroid stimulating immunoglobulins, attack the tissues of the eyes, resulting in thyroid eye disease. What Hashimoto's you have thyroglobulin well, there's a couple of antibodies that could be associated with Hashimoto. So thyroglobulin antibodies, which thyroglobulin is a protein in the thyroid, and so the immune system attacks thyroglobulin, damages thyroglobulin, and then there's thyroid peroxidase or TPO antibodies, which these are the most common types of antibodies, and we actually see them a lot in Graves too. I mean, they're more damaging, and it's not actually the antibodies themselves that are causing the damage, but more of a consequence. So, but again, like if someone has, let's say, elevated TSH in the presence of thyroglobulin antibodies and or thyroid peroxidase antibodies, then typically they'll be diagnosed with Hashimoto's. Whereas if someone has elevated thyroid hormones and low TSH, along with the thyroid stimulating immunoglobulins, and that typically
Mhm.
is diagnostic of Graves' disease.
Well summarized. Thank you so much.
Yeah.
Okay, so let's start with hyperthyroidism and Graves' disease, and then we can kind of shift into hypothyroidism and or Hashimoto's, right? So Graves' disease and is the autoimmune. How often do you see people have hyperthyroidism without Graves' disease? I don't know. I mean, is that you know what I'm
It's a,
saying?
yeah, no, I know exactly what you're saying. So they're most just what both Graves and Hashimoto's, some say that it's like 90% of the cases are autoimmune. So like 90% approximately of of hyperthyroid patients have Graves. But then there's also what's called like toxic multinodular goiter, where someone has swelling of the thyroid, which is the goiter, and then they have multiple thyroid nodules, and sometimes those nodules are what's called toxic nodules, where they actually secrete or stimulate the production of thyroid hormone. So that's an
Okay.
example of a non-autoimmune type of thyroid of hyperthyroidism. And then there's also subacute thyroiditis, which is usually viral induced, where someone
Mm.
they'll get a virus, and usually it's very transient hyperthyroidism. But again, that's not autoimmune either. So it's most of the people see me have Graves, but I do see some people with, for example, toxic multinodular goiter. Some people have subclinical hyperthyroidism where TSH is low, thyroid hormone levels look good, and antibodies might be negative. There's also subclinical Graves' disease where some people will have normal thyroid hormone levels, but will have elevated thyroid antibodies. Again, not as common, but I do see some people that have subclinical Graves, or again, just subclinical hyperthyroidism sometimes without that autoimmune component.
When you see that subclinical, like they have elevated antibodies, and I guess this could go for Hashimoto's or for Graves, but their thyroid hormones still look relatively good. Do you think that's because it's maybe early on that they caught it, or can that go on for years and years and years and years? Or what do you think when you see somebody has okay, they have elevated antibodies, but their T3, T4, like most of their other panels look pretty decent. What do you think when you see that?
Yeah, it's a great question. I mean, with Hashimoto's, I definitely think early process, because with Hashimoto's, sometimes that autoimmune process could be going on for like 10, 15 years before it affects the thyroid, which is an argument why you should test antibodies like well before testing even the
Yeah.
thyroid hormones because the antibodies develop before anything happens to the thyroid. So with Hashimoto's, yes, I definitely think it's like maybe the early stages if we see normal thyroid
Hmm.
hormones. Graves, a little bit different. I mean, sometimes that does seem to be the case. With Graves, though, it's a little bit different because also with Hashimoto's, like when someone starts experiencing symptoms, like if they get fatigue or weight gain, they might attribute it to something else. Oh, my diet's not great, or my job, or just I've been working
Hmm.
too hard. When someone starts getting elevated resting heart rate, palpitations associated with
Yeah.
hyperthyroidism, they usually pay more attention. But again, in subclinical Graves, they might not have that. So yeah, I would agree. Sometimes
Hmm.
it might be just a matter of time before it elevates, but it seems like it happens quickly. So I can't say it's just different than Hashimoto's, where Hashimoto's, I'd say, with most people, it's a long process, and it just takes a while to get diagnosed because they're not looking at those antibodies initially. With hyperthyroidism, again, it's not as common to get. So I guess what I'm saying with Hashimoto's, it seems like almost everybody is at one point subclinically hypothyroid, like their numbers look good.
Yeah.
With Graves, it happens really quickly. A lot of
Okay.
people like, just I'm not saying that there isn't like a transition period, but I guess most people who come to see me with Graves, it's not subclinical. Hashimoto's, it's actually very common to have like normal thyroid hormones. And again, so-called normal TSH within the lab range, but not
Right.
necessarily within that optimal range.
Mm. Okay. So with kind of leaning towards Graves, I'm going to mostly lean on Graves since that's like
Okay,
90% of people. Okay.
sounds good.
Like, can you speak on the genetic predisposition versus lifestyle, what your thoughts are around that? Because from the people that I have known that have had Graves, which is not many compared to Hashimoto's and hypothyroidism, it feels like I could be in a room of 100 people and there'd be like 10 people stand up or something. Uh, but like, a lot, it's like immediately, it's like, well, it's genetic, and I'm like everything, there's going to be genetic predispositions, but obviously you've been able to get yours into hopefully permanent remission, you call that. So can you speak on that, right? Like somebody out of nowhere, they're like, oh, it must be genetic. Maybe somebody in their family did have it. I don't know. Can you speak on the balance of genetic predispositions and lifestyle interventions with Graves?
Yeah, sure, I could do that. And of course, there's no way to know if I'll permanently be in remission. That's
Yeah.
the thing with the term permanent remission. I've been
Yeah.
for like 15 plus years, but I could relapse tomorrow. So that's the
Yeah.
the goal and the hope. And but yeah, with genetics, there does seem to be not just with Graves, but all autoimmune conditions, a genetic component, like as
Yeah.
part of what's called the triad of autoimmunity or three-legged stool of autoimmunity. And so you have the genetic predisposition, you have exposure to one or more environmental triggers, and then you have that increase in intestinal permeability, which is a medical term for a leaky gut. And
Mhm.
so genetics, I mean, sometimes there is a strong genetic history. Like if I ask someone, do you have a family history of Graves? And I'll have like some people say, oh yeah, my mom and sister have Graves. And then there'll be other people where it's like, no, I don't have anybody. And that was the case with
Okay.
me. There's nobody
Mm.
in my family, but still, it does seem there is a
Yeah.
genetic component. And but the good news, just as the case again with Hashimoto's and other autoimmune conditions, the lifestyle factors, finding, removing the triggers, healing the gut, that takes precedence over the genetic predisposition. So,
Yes.
if
Yes.
you find and move the triggers, heal the gut, correct other underlying imbalances, you can restore your health. Again, some people will say you're cured. Some people like me, a little bit hesitant to use the cure word just because of, again, that genetic component. But I'll be honest, I feel like I've been cured. I mean, I feel like I'm cured, um, but yeah, so genetics, I think, is definitely a factor, but not the most important factor.
Yeah. Thanks. Okay, so on this three-legged stool where we have genetic predispositions are definitely a thing, but I like to hit on the other two legs of the stool quite a bit.
Yeah.
Okay, cool. We're predisposed, but my mom had Alzheimer's and type 2 diabetes, but I really don't think those are coming my way based off of the knowledge that I have and the way that I'm living. And unfortunately, she didn't have access to that way of life,
Yeah.
And so um I think it's important to acknowledge how much power is in our hands. And we are getting more and more amazing information like on a daily basis. It's like it's going rapid. So, in terms of the power that is in somebody's hands, let's say they have Graves. We'll start with hyper. What do they need to be thinking about in terms of the root uh, strategies? What do they need to be looking at in terms of like the root cause of the problem and what to start addressing, and possibly like labs that they might want to check out to see what some of those roots might be?
Yeah, great question. So, I mean, it all starts with diet and lifestyle. So, and I think with any autoimmune condition, you want to clean up your diet. And there's no perfect diet that fits everyone.
Yeah.
I mean, I do like an autoimmune protocol initially. Again, even that it's not a perfect fit for everybody with Graves and Hashimoto's, and I realize it's restrictive, but it
Hmm.
serves as kind of an elimination diet, is the way I look at it. So
Right.
eliminating the inflammatory foods, the common food allergens. And so, but regardless, I think all practitioners would agree you want to avoid refined foods and sugars. You want to avoid unhealthy oils. I mean, I definitely recommend, again, at the very least, avoiding taking a break from gluten, dairy while healing. But like autoimmune paleo diet or AIP diet goes beyond that. Like you're avoiding grains and eggs and nightshades, and
And
so it's
alcohol.
and alcohol, yeah, alcohol. So yeah, I mean, alcohol. I mean, again, that it's one thing I think when you're in a state of wellness every now and then, having some alcohol,
Right.
but while
Right.
healing, the impact
Right.
that it has not only on the liver but on the gut too. So I think it's a good idea
Yeah.
to avoid the alcohol. And yeah, diet is huge. Stress is really big. When I dealt with Graves, I was in denial. I mean, I knew stress was a factor, but I was like, I'm good at handling stress. And then I had to do an adrenal saliva test to see how bad my adrenals were.
Mhm.
Everything was low. Cortisol was low. DHEA was low. Secretory IgA was low. And it wasn't just the emotional stressors, but I was also overtraining, which I should have known better. But I was, yeah, just again, just not listening to my body. So that's important to understand that it's not just emotional stress, but some people just overdo it when it comes to cardio or even sometimes resistance
Mhm.
exercise.
Mhm.
So it's exercise is great, definitely recommend
Mhm.
it, but just want to,
Right.
like I said, listen to your body. Sleep, of course. So I know we're getting into the basics, but I think it's important to cover the foundations
The
rather than,
biggest, most important
yeah,
pieces.
exactly. Rather
Oh,
than
they don't
okay,
just
what's
take curcumin. Just take curcumin. You'll be fine.
I was just about to say, rather than what's the magic supplement to take, but I'm not gonna, focus on sleep and stress management and
Right.
eating well. So yeah, I mean, those three: eating well, stress management, sleep, importance. I mean, we live in a toxic world, so doing things to everything you can do to reduce your toxic load,
Yeah.
just minimizing your exposure, not only eating organic food, but cosmetics, cleaners, just trying to use. Again, within reason. I know I'm not saying like I'm not perfect with everything. Like it's not like furniture. I can't say I
Yeah.
have like all natural furniture in my
Right.
house. That's all like
Do your best. Don't sweat the rest. Yeah.
yeah,
Yeah.
exactly. So yeah, and just I mean start with like your water. If you're drinking water out of plastic
Yeah.
bottles, which
Right.
are endocrine disruptors, the plastic
Yeah.
and things I would say switch to a water filter,
Hmm.
just air purifiers. Like again, so you could start with
Hmm.
that, start with some of the products you use more frequently and yeah, so I mean we live in a toxic world, like I said, so that is essential. As far as testing goes, I mean, blood tests beyond thyroid panel and antibodies. I recommend comprehensive blood testing. Vitamin D, we'll start with that because I'm sure others have spoken on this show about the importance of vitamin D. not only for bone health, but for immune system health. It helps modulate the immune system. So you want healthy vitamin D levels, iron. Like I do an iron panel on everybody, not just because iron deficiency is common, but some people have iron overload, and iron overload will cause oxidative stress, which could be potentially a trigger, or at least a
Yeah.
contributing factor. So, I mean, and of course, I do like comprehensive metabolic panel, complete blood count with differential, lipid panel, homocysteine is one that I
Mhm.
recommend. And everybody CRP, C-reactive protein, just again, so blood, dive deep into the blood test, insulin, hemoglobin A1C. So just to look at blood sugar, sometimes leptin. And I mentioned adrenal testing. So some practitioners will be like, oh, just let's assume that we have adrenal problems, which is true. A lot of people do have adrenal problems. I like doing adrenal testing because, like me, some people do need to be convinced that, and then
Yeah.
also it serves as a baseline. Like when my
Yeah.
adrenals were not good and I was able to do a
Yeah.
retest 3 months later and say, you know what I'm doing is working and now my adrenals look
Yeah.
like a lot better. So yeah, so adrenal saliva test is what I did, but there's also, I'm sure you're familiar with Dutch test, like dried urine testing that looks at circadian rhythm of cortisol, but then also looks at the sex hormones, how you're metabolizing the hormones. Um, Gut health. I have a newsletter, Healthy Gut, Healthy Thyroid, and the reason I have a newsletter like that is because again, you need a healthy gut to have a healthy immune system because most of the immune system cells are located in the gut. And then on top of that, you could have like certain gut infections, things like
Yeah.
H. pylori, parasites that could
Yeah.
be a factor in the development of these conditions. And so I'll do, and not everybody, but some people I'll do stool tests. There's organic acids tests. It really depends on the person, honestly. Like there's some tests that I like to do in everybody, and comprehensive blood testing is one of those. But that's what the health history is for, to kind of see like is someone having a lot of bloating and gas when eating like higher fiber foods, fermented foods. Well, maybe we'll do a SIBO breath test because we might
Hmm.
suspect SIBO, but I can't say I do a SIBO breath test on everybody. So that's where the
Right.
health history is important.
You know what I love? I love how comprehensive that list was. And like, we got to look at the gut. We got to look at these different blood markers. We got to look at your saliva cortisol. We need to look at your hormones, like what's happening with the metabolites in your urine and how are they processing and blah, blah, blah. Like, I don't know. I feel like it's so important. If anybody felt overwhelmed hearing all that, I just have to say these are things you need to know about your body if things aren't going well. You need like we get tune-ups on our car, we get, checkups on that, change our oil, whatever. But like there's this weird belief. I think it's because we're honestly our bodies are so amazing at auto healing most of the time that we just like want the easy, just it'll work its way out or whatever. Or we're used to Western medicine where it's like, here, suppress your symptoms with this, not across the board, but sometimes that does happen, and I think it's beautiful to hear all this. That's where my mind goes too. There could be a lot of things. And of course, when they're meeting with a professional, you're going to be like, well, let me make an ed. There's some foundational labs I'm going to need to see here because I have no idea what your vitamin D or your lipid panel or like your iron. There's no way for me to know without testing. But then some of that additional testing, like you're not going to just test SIBO for no reason. It's like, okay, this sounds like SIBO. Let's test, and I am yeah, I'm looking forward to a day where it is already happening. It is already happening, but we're starting to become more and more conscious of like, hey, what is actually going on inside my body? And let me actually take care of it. Yeah, so I love that
Exactly.
list. I have to hang one more question on this hyperthyroidism before we move over to hypo because it's kind of personal. So only answer this as much as you feel like it. But when I hear you say that you were like not kind of in denial about how much stress load you had on you, like as much as you're willing to share, like what felt different about your life when you decrease the stress load, like day to day? Does that make sense? Because that's managing stress is something that I find to go in one ear, out the other, but it's almost like you have to go through a, like, huge life change and a lot of deeper work to not be in such a stress state because a lot of people are addicted to it and they'll just refill it with something new. It's kinda there's deeper stuff going on, so even if just on a basic level, like, what did you do to make your life less stressful? Like, or what did you experience day to day?
Yeah, I mean, well, in full disclosure, it's always a work in progress, and I'm a
Yeah.
workaholic. I take on a lot of things between the podcast and writing books and seeing patients.
Yeah.
So again, it's I think the biggest thing though is blocking out time for stress management on a daily basis
Nice.
and not so
Right.
I can't say I've
Yeah.
reduced a lot of the stressors that associated with work, but just do a better job of handling it. And also I mean taking
Mm,
care of my body but while not overdoing it as
right.
well. And but the
Mm,
big thing is daily. Like there are some people that will say, well, I do deep breathing or I do yoga, but it's only maybe 2 or 3 times a week. And
hmm.
I think you really want to get into the routine of stress handling. And I think that's what I've done a
Nice.
much better
Right.
job compared to what yeah. So
Mm,
it's, and again, it's not like every single day I'll spend an hour on stress management. Sometimes, some days it might be only 5 or 10 minutes, but
yeah.
still I do what I can
Hmm.
do. But
Hmm.
I mean, so what I recommend is start with 5 minutes and then get in that routine every single day and then gradually increase to 10, 15, 20 minutes. And maybe some days you do 20, 30 minutes. Some days you only do 5 to 10 minutes. And if someone is listening to this and they're like, I just can't find 5 minutes to block out time for stress management, then those people need to do it the
Yeah.
most. Because again, if you can't find 5 minutes, I
Yeah.
know it's every day, but still, I mean,
Right.
5 minutes, everybody should be able to block out that small amount of
Yeah.
time.
Yeah, I love that because I'm hearing one that you had this intention daily of like just the mindfulness of like, hey, I gotta have a pattern of downtime, even if it's just a little bit. I like this because one, it's like doable and manageable, right? But also, I'm hearing that you weren't stacking overtraining on top of a high demand lifestyle, and I think this is so important to highlight because this is definitely my experience. Because usually I get hypothyroid clients and they're like really trying to lose weight and so they're doing like these like crazy, like no rest intervals, like, come on,
Mhm.
just freaking lose the weight, like, and they don't have much of an appetite because they're hypothyroid. So they feel like I'm barely eating anything and I'm like working out like crazy. And I'm like, whoa, we're going to walk and like lift with long rest intervals, like,
Yeah.
and I just think it's such an important thing to note on both of these is what I'm hearing. Like, do not stack, even whether you're hyper or hypothyroid or not, do not stack a high stress lifestyle with overtraining, or your body is going
Yeah.
to be like, well, thanks a lot. That was too much.
Agreed. Yeah.
Okay. Thanks for that. Okay. So let's tiptoe over to I want to hit a little bit on hypothyroidism without Hashimoto's, because not
Mhm.
everybody who has hypothyroidism has Hashimoto's. So, like, what are your thoughts around that in terms of, well, I don't know if you even have, want to share your opinion, but like, do you have any thoughts around like why that is increasing so much?
Well, I kind of hinted at it earlier. I mean, one reason is our toxic environment and the endocrine disrupting chemicals that are becoming more and more
Yeah,
widespread, including microplastics. Now we're hearing
right.
about microplastics and nanoplastics. So, in clothing and I mean, everywhere, you hear
Yeah.
like the sea salt that you're using on your. So I
I
think
know.
that's a big reason.
Yeah.
Just the endocrine disrupting chemicals.
Yeah.
Uh, I mean, stress is a factor as well. Now, stress affects the conversion of T4 to T3. So but still, like if someone has normal T4 levels and lower T3 levels, that's still a form of hypothyroidism. That's a conversion problem, but stress could be a factor. I mean, most of that conversion takes place in the liver and the gut, so those could be factors as well. But um, I mean, even in some like extreme cases, like doing extreme like intermittent fasting. I'm not against intermittent fasting, but if someone's doing like a 20-hour fast like every single day and only having like a 4-hour eating window, not getting enough nutrients, not getting enough protein. Again, I can't say, I mean, I do see people do that, but I can't say like most people with hypothyroidism, that's the reason, but that also could be, potential. But I would say probably the number one factor would be those endocrine disrupting chemicals. But the thing is also they could affect permeability of the gut too. They could affect the immune system. So they could
Right.
also lead to like a condition like
Yeah.
Hashimoto's or Graves.
Yeah, it's funny, like, because I mean, I don't know if you've noticed. I saw that you said you're an Instagram newbie. I'm not an Instagram newbie. I have been all up on Instagram for like a decade. And I think like I've noticed there's like this growing camp of people who are like really out to get the functional medicine crowd of like, oh, you guys and your I was the recipient of this one. So it was super fun. 3 videos in one day. It was like a whole army coming against me because I
Mm,
said something about chemicals on produce. But anyway, like there's kind of like this interesting surgence of like, oh my gosh, you guys and your chemicals, like it's fine, like it's not validated by science. Blah, 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 blah. I'm like, first of all, there is plenty of it that's validated by science. Second of all, just on a really, really basic level, just zoom out and look when plastics and all these chemicals, which are really new, like plastic wasn't even on a broad scale until like a very broad scale until the 70s. Like a lot of people who listening to this were like alive when that got like big.
yeah.
You know, I don't remember everybody having plastic water bottles going around when I was a little kid. Nobody had that. Nobody had that.
Oh,
That
I agree.
happened.
Yeah.
I'm
Yep.
only 42. So like
Yep.
this is like very new. This is very new. And look what's going on in the health of people. It's like every single, not every single, but like so many suboptimal health outcomes are just going crazy right now. And it just blows my mind that people want to like not notice. I mean, I know it's correlation and not causation. Okay. But it's just
Yeah.
on a very basic level, it seems very obvious to me. So anyway,
Yeah.
sorry.
Oh,
I had to.
I agree. I agree. And there, like you said, there's plenty of research too to back it up, especially
Right.
like the microplastics, the endocrine disrupting chemicals. So it's not definitely not theory.
Right.
Yeah.
Okay. Cool. Yeah. So just a big plug for that to not I guess the reason I highlight that is because I feel like that's also another thing that kind of sort of gets brushed under the rug in people's minds when they're dealing with an autoimmune condition is like, oh, you know, when it's new, at least. It's kind of like, okay, yeah, clean up my stuff. Oh, get an air filter in my house and like water, clean my water, like whatever. Oh, for shampoo. Oh, I gotta change my all these products. But I think it needs to be boosted way up because everyone that I know personally that has like really overcome their autoimmune stuff is that way. They really clean up their environment. So I just wanted to highlight that for a second. Okay.
Yeah.
Um, so all right, let's go over to just maybe combining Hashimoto's. Um, let's go to I mean the root cause stuff is there anything different from your hyperthyroidism list there
You
on
know, it's funny you ask because well, because I have a book, Hashimoto's Triggers, and sometimes I kid around
right.
that I could just like cross out Hashimoto's and put Graves' disease
Yeah.
triggers, and there, I mean, because probably like 80% of what's in that book it
Okay,
would
yeah.
apply to Hashimoto's too. I mean, you know, there's food, there's stress, there's toxins, there's infections, you
Mhm.
know, there's nutrient deficiencies. So you are right. I mean, in the literature, there are some there's like some case studies showing that Blastocystis hominis, which is a parasite, again, correlation doesn't always mean causation,
Mhm.
but might be a factor in like Hashimoto's, but there's not
Hmm.
studies showing that with Graves. But again,
Okay.
it doesn't mean it just means
Mhm.
that the studies might have not been done also, so we got to like
Right.
factor that. But I mean, to answer your question, really just for the most part, there's the same triggers. I mean,
Mhm.
so like what, because also, this is also worth mentioning, a lot of people, I'd say at least 30%, 20-30% of people I see have antibodies for both Hashimoto's and Graves' disease. So, and again, so the question is like, well, what do we do? Do we focus on each individually since they're like different antibodies? And the truth is that most people do have multiple, there's overlap between Graves and Hashimoto's triggers, but then also most people have multiple triggers. And I mean, sometimes it's weird because sometimes we'll see, let's say if someone has all three antibodies I mentioned earlier, we might see as someone's health improves, we might see two of them dramatically decreasing and then another one not moving or actually
Hmm.
increasing. And so the question is, well, could there be a different trigger? Like again, and the answer is yeah, you could have different triggers. But so to answer your question, there definitely is overlap. And I would say overall, the
Hmm.
main difference with Graves and Hashimoto's, or one of the main differences, is obviously the symptom management aspect. And that's if someone walks in with hyperthyroidism, you're gonna do things to lower thyroid hormone levels. Where if someone has Hashimoto's, again, some people need thyroid hormone replacement, some people don't. But from an autoimmune standpoint and from a gut healing standpoint, uh, really there's a lot of similarities in the again. So yeah, like it's the same test that recommended earlier really apply to both Graves and Hashimoto's. So I can't say like, I've got Hashimoto's. Like with Graves, we're gonna do, you know, a comprehensive stool test. Where with Hashimoto's, we're gonna do mycotoxins testing. Again, like we could see mold in both Graves, Hashimoto's. We could see, of course, gut issues in both Graves, Hashimoto's. So yeah, definitely overlap with
Hmm.
both conditions.
You kind of mentioned viruses, and I see Epstein-Barr popping up a lot. Like, do you see that a lot as like a triggering one of these, or what's your thoughts around, these chronic viruses that like to lurk around, especially Epstein-Barr, I think is so common. What's your thoughts on that?
Yeah, that's a great question. And that's in the literature too, like Epstein-Barr with both Graves and Hashimoto's. Again, is it correlation? Is it,
Right.
I mean, it's, correlation doesn't mean causation, as we said, but most people are positive for Epstein-Barr. There's different antibodies, like there's IgM, which definitely means that it's active, and then there's three different IgG antibodies with Epstein-Barr. If someone has like the early antigen IgG, that typically means that it's reactivated, whereas if they have like the VCA IgG and the nuclear antigen IgG, doesn't necessarily mean that it's activated. Most people have that, probably like 85, 90% of those people. So with viruses, I look at them, I mean, sometimes I'll treat them like, but I look at them more as an immune system problem than a virus problem, just because you're not going to get rid of Epstein-Barr once it's in your body. You're going to have to try to live in harmony with Epstein-Barr. And so, yeah, you could like take antiviral agents like olive leaf and things like monolaurin. And I mean, there are other natural antiviral agents. But if you're not addressing the immune system imbalance, like again, if you're dealing with chronic stress all the time and you just take olive leaf and monolaurin and other antiviral agents, it's not really going to do much if you're still in that chronic state of stress. If you're dealing with toxic mold and if that's dragging down your immune system, or again, you have SIBO or parasites that's affecting the gut and most of the immune system cells, as I mentioned earlier, in the gut. So again, I'm not saying I never like will treat Epstein-Barr, but in the past I always treated it like, okay, let's put someone on an antiviral protocol. But then it's like,
Mhm.
you really want to address the immune system component. Um, but I will say COVID. So getting to COVID, when COVID hit in 2020, we had a lot of new cases of hyperthyroidism, and that's in the
Mhm.
literature too. Like definitely COVID can cause hyperthyroidism, can cause Graves disease, and so. But again, like even in that situation, I'm not saying there's not a time and place for antivirals, but really it's about optimizing your immune system to try to prevent that from happening in the first place. To try to like, because again, we always get exposed to viruses day in, day out, and not everybody. I'm sure, maybe you're hopefully one of those people where, like, when everybody else is sick, maybe you're not sick just because, again, you have a stronger
Mhm.
immune system, a healthier immune system. And, I find that to be the case as well with me, where, knock
Mhm.
on wood, I don't get the flu
Mhm.
every year. I mean, yeah, so it's, again, viruses definitely could be a factor, but you really want to address immune system. And one more thing I'll say is Lyme is similar too, because I dealt with chronic Lyme in 2018, and back then I was like, okay, I'm gonna, get IV ozone, which I did, and UV light, and I took herbs and homeopathy, and not to say that didn't help, but that's not it's not a long, those aren't long-term solutions. It was really, I really had to look. And again, this was 10 years after dealing with Graves, after my Graves diagnosis. And I was already doing a lot of good things, but I honestly had to circle back to the stress and say, well, maybe it's, maybe I'm not doing as good of a job stress-wise. And, I looked at other things, even things like EMFs, electromagnetic fields, which, a lot of people think is like woo-woo, but again, I wanted to cover all bases and just be like, I'm going to continue to do things to optimize my immune system health.
Yeah.
And so Lyme, similar to viruses, is something that I look at more. Not to say it doesn't exist, but it's more of an immune system problem, meaning you got to focus more on the immune system than the actual
Mhm.
pathogen.
Right. I love that. That's kind of, I feel like, where we've come with the gut microbiome too, is it used to be like attack, kill, attack, kill. And now it's like, no, 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 create a healthy
Yeah.
environment. Create a healthy environment. It
Yeah.
just kind of takes care of itself. So that's how you're looking at the immune system. I love that.
Yep.
Um, Man, I was like, what other? Oh, let's go to so somebody's sitting here listening to this, right? And they're like, I like Hashimoto's, let's say, for example, or maybe Graves. And they heard you say this about like leaky gut. They're like, huh? Obviously, like I highly recommend getting professional help if you have any of this. Okay. Because it's like you just heard how many things Dr. Eric listed off that he would think of. Like, you're not even going to know to think any of these things. You know what I mean? So I like, yes, get some help. But in terms of just somebody, maybe they, I don't know, feel like they can't or something, and they just kind of want to see what they can do on their own. And they're like, huh, leaky gut. Like, what would you recommend for somebody just to, God, I do gut stuff myself and gut testing. I'm like, I don't even know how I would answer this because there's so much nuance. But in terms of having the best chances of helping the gut thrive from a general public level, like, are there any recommendations you would make? That's such a hard question.
Yeah, well, I mean, I do want to start before answering that. I I used to do a lot of testing for leaky gut, and I no longer do just
Oh,
because
nice.
so it's not like I'm recommending for when I do something like comprehensive stool panel, I'm trying to find out what's causing a leaky gut, because that's the
Right.
thing when you do leaky gut testing, it's not telling you what caused the leaky gut. And then I don't trust all of the markers, like zonulin is one that
Uh-huh.
you could test for, and if it's elevated, you probably do have a leaky gut, but if it's normal, it doesn't always rule out a leaky gut. And so it
Yeah,
might
I'm
give
not
someone
testing. I don't do that either. I'm doing
yeah,
the functions and we're looking for signs. So I'm with
yeah,
you on that.
exactly. So yeah, there's definitely things people can do on their own, and we've discussed some of them. I mean, the diet is number one, just with trying to avoid, especially the common allergens. So gluten definitely can affect that permeability of the gut.
Mm-hmm.
Um,
Mm-hmm.
I'm not saying all grains are bad. I mean, there's different perspectives, but I know in the literature, like corn is one that, again, I'm not saying forever, but
Mm-hmm.
just again, that has been shown to increase permeability. And then if you're eating corn, you want to make sure it's organic because most of the corn is GMO. But even besides that, it's not even the GMO factor. But
Mm-hmm.
trying to avoid those foods. We spoke about alcohol, which can affect permeability of the gut. So try to do as much as you can from a diet perspective. I mean, even stress. Stress will decrease secretory IgA, which lines the mucosal surfaces of the gut, and that can make you more susceptible to leaky gut. We mentioned again the different toxins that are out there that again in the literature, this is not theory, where some of these
Right.
microplastics, mycotoxins can also affect the permeability of the gut. Glyphosate, which can cause dysbiosis, glyphosate, the active ingredient in the herbicide Roundup. So trying to eat organic as much as you can, trying to, again, so really we spoke about a lot of the things people can do on their own, which is, again, diet, lifestyle, stress management, reducing their toxic
Mm-hmm.
load. And for those with hyperthyroidism, I focus on this in my book, The Hyperthyroid Healing Diet, but then also even Hashimoto's Triggers book. For those with Hashimoto's, I talk a lot about diet. I mean, a lot of it also is also testing to find triggers and stuff like that. But of course, I
Mm-hmm.
spend a lot of time on diet and lifestyle. But yeah, do as much as you can from a diet and lifestyle standpoint, reducing your toxic burden standpoint. I mean,
Yeah.
supplement wise. I mean, I like supplements, but again, diet is important. But diet is
Right.
going to be a
It's like a,
priority when it comes to, yeah.
yeah,
So, yeah. So yeah, I mean, you could drink bone broth to help
yeah,
support the gut. I can't say that I drink bone broth like every day to maintain
yeah,
a healthy gut, but it is good. That has some
yeah,
good health benefits. But yeah, so those are my
yeah.
thoughts as far as trying to optimize gut health.
Thanks. Yeah. And I'm just echoing one you already gave before is sleep because I have,
Yeah,
especially for the hypothyroid women that I've worked with, like they are trying so hard because they usually just gained like a lot of weight really fast. And they're like, holy crap, I don't even feel like myself anymore. And so they're like really hitting the gym hard and go, 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 go. And I have seen way, 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 way more progress when I put them on like the sleep training routine where your workout this week is sleep as much as you freaking can. Like that is usually how I say it to I'm like, sleep as much as your body will let you do it. Like if you want to take a nap, please. But as long as it doesn't mess up your nighttime rhythm. But like that sleep has been such a game changer. Oh my gosh, like sleeping a lot. Cause I find a lot of people deprive themselves of
yeah,
sleep because they're trying to like get after it and go get it. But like, especially if your body is already showing signs that it's struggling, I about it. Sleep to me is like the body like turning off our egos turn off and it's like, okay, let us do we know how we work. Yay, you just enjoy the dreamland and we'll fix everything in here, you know? It's like the master healer. So just echoing that one,
yeah.
which you already listed before as well.
I agree. And one thing also with that, because a lot of people have sleep issues, which could relate to a lot of different things,
True.
but rather than jump to the supplements for sleep, let me take some melatonin and other things. And not to say there's not a time and place for that, but sunlight in the morning to like kind of
Yeah.
reset your circadian rhythm when you can. I know not
Yeah.
everywhere, you're not going to get sun every morning,
Right.
and then making sure I'm minimizing exposure to like electronic devices at night, room
Yes.
completely dark. So again, getting back to
Yes.
the basics.
Totally. I'm gonna go sit in the sun right after this. I've had a daily goal of at least 20 minutes fully in the sun. I live in Hawaii, so
Awesome.
it's like pretty
Yeah,
pathetic not to do that.
you got to do it.
Yeah. All right. Well, Dr. Eric, thank you so much. We'll refer everybody in the show notes to all the different places they can find you. We'll link up all of your books and make sure again you guys check out his Save My Thyroid .com/newsletter. You can sign up there, but we'll link it in the show notes. But his newsletter, he sends out incredible information. And of course, if you want to learn more about this, you can check out his podcast, the Save My Thyroid podcast. So yeah, we'll link that all up. Dr. Eric, thank you so much for taking the time and sharing your expertise with us today. It was super informative. Thank you.
Thank you. Thank you so much, Tara. It was great being here. Appreciate you having me.
Thank you so much for joining me on this episode of the Inside Out Health Podcast. I hope it's been helpful to you in your journey. If you think that it might be helpful to someone you know, please share it with them. Please share on social media. It really helps me grow the show and reach more people with these amazing messages. And if you could be so kind as to rate the show and possibly even leave me a review, that really helps. So much thanks in advance if you do that. And yeah, please subscribe if you want to hear more of this type of content. I have lots of amazing expert guests on the way. All right. Thank you.